The folks at DFID asked me to talk specifically about how the Washington Group questions are used for monitoring the SDGs and for the UN Convention, so I'm going to focus on that. But there actually are much more than that, and I just encourage you to go to the website so you can kind of see the full range of things. As Alarcos explained, the concept of disability that we're operating under right now is a very complicated one. It is an interaction. And those of you who spend time, as I do, writing survey questions know that the hardest thing to capture easily in a survey question is something about an interaction, particularly when you're trying to get consistency of responses not only within a country that might have very different ethnic groups or regional groups, but also internationally. The Washington Group, as I'll explain in a minute, is a group of national statistical offices. And so when we approach the task, the challenge of developing methods to collect disability data, we're coming at it from an NSO perspective, collecting data as NSOs collect it. And if you ever worked in a census office or anything else, the key theme is short. Every question costs a lot of money. And you don't want to burden respondents, and you don't want to spend a lot of money, so you really need to get a limited number of questions. Because we wanted to incorporate the information on disability into the core data collection systems in the countries, and we call it mainstreaming the collection of disability data. So it would always be there. So we wouldn't be in a situation as we were in the MDGs, where disability was missing because nobody had any data, because it wasn't part of what they were collecting. So you wouldn't think of doing a survey and not collect age or gender, or do you live in an urban-rural area, or education, or whatever. Well, we wanted to create a tool that was short, that you can insert in your ongoing surveys, wouldn't be too burdensome, so that it would become part of the core national data. And it would be there on an ongoing basis for monitoring and to build upon. So we're talking about a minimum set, if you will. At the time that we started, which was around 2001, I would say that the status of disability data was appalling. I think most people would agree. There were lots of tables with estimates on it. They were completely not comparable. Nobody was believing it. And I think from a policy point of view, the people using the information were saying, how could you have 30% of the population with a disability in Australia and 2% in a country that just underwent a major war in sub-Saharan Africa? So obviously, all of this stuff is nonsense, and we're going to disregard all of it. So we needed to be collecting information in a consistent way, in a comparable way, cross-nationally, so that the data would be believed and would be used for policy purposes. And again, we wanted to incorporate it into the ongoing data collection system. So the Washington Group is a city group. These are entities that are established under the UN Statistical Commission to focus on a particular statistical issue, come back to the commission and report. It was actually set up in 2001. Our first meeting was in 2002. And I think what's interesting about these groups is they're country owned. So it's different than a UN agency doing something and involving countries. This is countries doing things for countries. The Washington Group is quite unique in the history of city groups. Usually they're quite small, very targeted, very technical. This one is very large. We have over 130 member countries. They are not all very active, but they all are involved. We also include international organizations, and we include organizations of persons with disability. And I think that just reflects the policy interest at this point in time in disability-related matters. And while the members, technically the members are the NSOs, we have these adjunct members, and we want to get the input from these other organizations. So they've been meeting with us over the 15 or so years that we've been working. The other thing that we committed to really early on was that every decision we made had to be evidence-based, and it had to be very transparent. And this was to kind of create the belief on the part of not only the NSOs who were going to have to incorporate these measures, but also the people using the data, that in fact they did measure what we said they were measuring. We had to have some credibility. We had to show evidence. We developed a very extensive cognitive interview evaluation program, which I don't have time to talk about, which actually might be of interest to this group. That is documented on our website, but everything is documented on our website. Every decision, every development of the conceptual framework, all the question testing. And we did a lot of question testing. We had money from the World Bank, from UNICEF, and now from the government of Australia. I would say that the short set of questions, which I'll talk about, 6 short questions, have undergone more testing than any other set of questions in the history of man or woman. They are very highly tested, and all the information is out there. So what was our approach to this problem? We understand that it's an interaction, although interestingly enough, in the discussion of disability, the same person can use disability twice in the same sentence and mean 2 totally different things. The first time they use it, they actually mean the within the body functional ability, and the second time they use it, they mean the participation. It's just a way that we use language. We decided that we had to take a very specific and targeted approach given our data collection objectives of having these integrated international statistical systems. We did not believe, and I think we would say we still don't believe, that you can directly get at the interaction, that you have to get it indirectly. We started before the UNCRPD. We started before the SDGs, but the countries agreed that the most important thing was to get a way of being able to evaluate whether or not persons with disabilities were equally participating in society. Now, I would absolutely agree with the continuum, and we'll talk about that. Disability is not inherently a dichotomy, but the Convention on the Rights of Persons with Disabilities forces you to identify a population with disabilities to determine whether they have their rights. And we want to do that in a very open way. But how do we do that in a way that will be policy relevant? So we decided that our definition of disability would be those who, because of a health condition, and here it's not related to health, this is not the medical model, but there are many reasons that societies discriminate against people. We do not want the discrimination to be from something else, like the color of your skin or where you live or your this is something that's coming from the body. Because of that, we want to identify people who have difficulties with basic universal activities that put them at greater risk than the general population for limitations in participation in an unaccommodating environment. I know that's a mouthful. But basically what we want to say in there, I was kind of hoping Alakris would show the ICF model. We measure in the middle, and we're saying if you meet your CRPD goals and the SDGs, then if you have some kind of functional limitation in core functioning domains, we will break the link that has existed between those functional limitations and participation. So if you cannot see or you can see, it makes no difference in whether you'll be employed. That's what we're trying to get at. That's why we put the definition within the person, and we take advantage of the fact that the surveys we're putting these questions in already get the participation stuff. So if we put in a labor force survey, they already know about employment. We put in an education survey, they already know about that. We put in a health survey, they already know about use of services. We don't have to pay for that. Okay, someone else is paying for that. These questions do not directly measure the environment, and I absolutely agree. It's the environment that causes the break in that connection. We are not directly measuring them here because this is done for the disaggregation. But in the things I don't have time to talk about today, which are on the website, we do have other modules that more directly look at the barriers and the facilitators. So we believe we're within the ICF framework, which is this interaction model, and we have tried to translate that framework, which is basically is in code, into survey questions that can be asked, and they had to be able to be asked on a census. And as the question you asked was because that's where you get your biggest sample size. For many countries, it's the only data collection they can count on. They will always do a census, and you can look at regional variation. Census is probably not the greatest place to ask things like disability, but it's the only place you're going to get something big, and we can do a lot of intersectionality. So we said, well, we're going to create questions that you could put on a census, and if you can put it on a census, you can put it on a survey. And if you can put it on a survey, gee, other people have come to us and said, gee, can we put it on, we're doing a project in X country, can we put it on there? Site Savers, for example, came to us and said, could we use your questions in our intake forms? We had never thought about it. They did it and it worked. Because the way they were created, it turns out they're good for other uses. So again, this is what we're trying to say. We've divided the population into those with and without disability, and we could make many more classifications. But because of the convention here, we're dealing with 2. And we would say, if you meet your CFRD requirements, those bars should be the same. It's a very simple thing, but it's a very politically powerful thing. If you are going to your government and saying, you signed on to the convention, and that's what we look like by employment, you government have to do something so that we are now equal, because you've made that commitment. And this tells them whether or not they've met that commitment. And this is what we were trying to do in a very cost-efficient, reduced burden way. So we did the short set. It took us a long time. You remember I told you we started in 2002. By 2006, we had developed the short set. And I'll show you that short set. And it measures functioning in 6 universal basic activities, 1 question per domain. You couldn't go beyond 1. If you had a domain that you needed 2 questions, it wasn't going to be on there. And there are certain domains that don't work well on a census, like psychosocial functioning. Many countries are going to do that. So we focused on things that we thought we could get on a census. But we know that 6 questions isn't quite enough. So we did the extended set for functioning for adults. That was adopted in 2010. That has many more questions, has many more domains, and starts to make the connection between what is my functional capacity to what's my participation, what are the intervening. We start looking at assistive devices there. And then in collaboration with UNICEF, we did a particular module which we just released in 2016 on child functioning. Children are very different than adults in this area, much harder to do children than adults. So those and some combination of the short and extended set that we're working on, those are that part of the model that's within the body. Then we started looking, again with UNICEF, on a module on inclusive education, which is, well, if we know their functional status, now, are they in school? If they are in school, are the problems in school? What are the barriers? What are the facilitators? If they're not in school, what are the barriers? And so that module's almost done. And we're now adding lots more questions. These are not going to be modules that go on a census. They're probably not going to be modules that go on a labor force survey. Well, actually, the employment one will. But MIX, for example, is going to use the child functioning module, but they probably won't use the inclusive education module all the time. You may have to have a special survey or an education survey for that. With ILO, we developed a module on inclusive employment, which they are going to try to put on their labor force surveys. And we're still working on the mental health psychosocial functioning. That's a very difficult one to do. And we chose to approach the environment from backwards, kind of from the specific aspect of participation. Adults work, kids go to school, what are the barriers there? Because we're doing this, again, internationally, if we want to look at environment more generically, it gets very difficult because of the difference in the transportation systems. But we're still looking at doing that. So the short set, this is the short set. There is this very short introduction, which we say you basically only use if you need to. If you're doing these in a census, the questions before this might be on your sanitation system. It just happens to be where they fly. So you need some kind of transition. The questions are very direct. Do you have difficulty seeing, even if wearing glasses, hearing, walking or climbing stairs, remembering or concentrating, self-care and communicating, with 4 answer categories, which is the way we get our continuum. When we started, these questions were way more complicated. It was like, because of a health problem that's lasted 6 months or is expected to last, blah, blah, blah. And when we did the cognitive testing, we found out that nobody was listening. You know, you put yourself in the respondent, they just want to get the question. Ask me the question, I'll answer it. Don't give me all this beginning stuff. And actually, by having all of that introductory stuff, we were introducing measurement error rather than getting rid of measurement error. Every time we did a round of testing, we cut, until we wound up with stuff that's really short, very straightforward, easy to administer, and easy to insert in other kinds of data collections. Translation is an issue, and I'll tell you it's more of an issue in the response categories. We're trying to get a spread there. If you translate those incorrectly, you louse up the whole distribution. So we now have very extensive guidelines on translation on how to do that. So what can we get from the questions? Well, we get internationally comparable data. The test results show that people interpret these questions the same way around the world. We can use these questions to fulfill the monitoring requirements for the Convention on the Rights of Persons with Disabilities and the SDGs. We get domain-specific distributions for the 6 domains. We can do combinations of the domains. If you want to look at seeing and vision together, if you want to look at vision and walking together, you can do whatever you like. And we can do this overall disability indicator, which is important for the disaggregation for the SDGs. And you can use different cutoffs, as Alakos explained. You can do it as many cutoffs as you want. And I absolutely agree, the cutoffs chosen have to be policy relevant. Every time someone says to me, what's the prevalence of disability? I cringe. Because there is no one prevalence. If it's a continuum, there is no one prevalence. It's where do you draw the line? And where you draw the line will depend on what you want to use the data for. So this is US data, because I have access to US data. And it's just showing the distribution on the 6 domains for the adult population. It's from our health interview survey. The US, interestingly enough, has higher levels of at least some difficulty than many other countries. We have high expectations of what we should be able to do. But when you get to the allot and the unable, things tend to coalesce a little bit more. The some difficulty group is a lot more heterogeneous. As we had expected going in, mobility is the highest prevalence. And the unable to do is quite low. Now, to do the disaggregation, you need the continuum, and then you need the cutoff. So as we've developed the questions to get the continuum, we've also decided on an internationally agreed upon cutoff. We don't want some countries using a cutoff of some difficulty and other countries using unable and putting that on a UN website and comparing across. So we have a standard, not only a set of standard questions, but a set of standard analytic guidelines on how to put it together. You'll get the prevalence, but you really get the disaggregation, and that's what it was designed for. So our recommended cutoff is at least one domain that's at least a lot of difficulty. That the folks with some are of interest for certain things, but for major policy initiatives, for the CRPD, for the SDGs, we're really interested in the somewhat more severe. And it makes a huge difference in the disaggregation. So these are the prevalences for the different cutoffs. So if you just look at least one domain with one some difficulty, almost over 40% of the US population reports some difficulty in one of those domains of the 18 plus. If you look at 2 domains, you're down to 20%. If you look at a lot of difficulty, it's almost 10%, and at least one unable to do, it's just 2%. Now this is the simplest way to analyze these data. We're working on a full set of analytic guidelines of how to put it together, but if you just want to do the disaggregation, we say pick the one in red, use your disaggregation. Since you've added these questions to the surveys that have your SDGs in them already, you can now disaggregate all your SDGs for just adding 6 questions. And this is an example of what happens when you do the disaggregation based on the different cutoffs. Again, this is US data. These are people of working age, so the prevalences are a little lower. So if you look at people who have one domain with at least some difficulty, we're down to about 35%, and this is 18 to 64. The percent working is pretty close. It's 76 versus 60. I mean, there's still a difference between the ones without a disability and with, but it's not that different. You have to have at least 2 domains with some difficulty. We're down to 15%. Now we're beginning to see some spread, right? 75% versus about 50%. When you get to our recommended cutoff, at least a lot, for this population, we're around 7%, and now you have a much bigger spread, 73 versus 31. And if you look at unable to do, that's when you get the biggest spread, 71 versus 15. I don't want, if I'm going to use this, the one domain with a lot of difficulty, I don't want to be compared to a country that's using one domain with some difficulty, right? Because they start out looking a whole lot better than I will, even though we're really in the same place. So it's really important that the same cutoff be used when people are reporting these disaggregations. And then you have to have the same underlying data structure in order to make the same cutoff mean the same thing. And this is just to give you a couple of other examples. We looked at smoking and health insurance. In the US, people with a disability smoke at a much higher rate than those without. But the insurance is about the same. I think that just reflects this strange kind of health insurance system that we have. But these were just by items that have been on our health interview survey forever. And once we stuck the disability questions in, we could do the disaggregation. We have on our website a whole lot of implementation guidelines. The thing that we always say, there's certain do's and don'ts. Among the do nots is do not add a screener. Never ask the question, do you have a disability? You then introduce everybody's preconceived idea of what a disability is, lack of comparability across 5 people in the room, so the wrong thing to do. And any screener, because you can't, it's just at too high a level. You really don't pick up what you're looking for. We want to get rid of any negative language, never use the word suffering. Everything should be neutral. These are questions that we do not even call disability questions when we put them on a survey. We don't want to get anyone's preconceived ideas. We tell countries don't put the word disability on the paper. These are just standard. These are things everyone does. They're universal. You just ask them like you would ask any other question. Train your interviewers to be neutral. Ask the question. Don't make them afraid. We have had NSOs that say, well, we tell the interviewers it's going to be hard for people. They're going to get upset. If you tell the interviewer that, the interviewer will transmit that somehow to the person and they will be upset. You want the interviewer to be very neutral. I've never understood why these would upset you more than if you're very poor and people ask you about your income. I mean, that would also be upsetting. And the don't change the response options, and I talked about that. You do have to do very careful translations, but that's true of any questionnaire. That's not unique to this. You really should test the questions using the guidance we provide. If you're doing translations, we encourage people to do a quick cognitive interview to make sure that it's working the way it was, and train the interviewers, but don't train them on disability. Train them to ask questions the way they normally would ask them. So as I said, the idea behind this particular part of our work is to mainstream disability statistics. You can add them to any ongoing data collection, health surveys, labor force surveys, the DHS, you can include them in the DHS. There's an optional module. They are all included in the multiple indicator cluster surveys that UNICEF does. Once they're in there, they tend to stay. They become integrated into the ongoing data collection. And you can do that, you can get the prevalences, you could describe the functional status of the population, and you can do the disaggregation. So as I mentioned, USAID includes them as an optional module. UNICEF is actually using the child functioning module, which I didn't talk about very much or at all, and the adult short set in all of the mixed surveys, and the World Bank is using them in their household survey program. We try to keep track of what our member countries are doing. At last count, they had been used in about 78 countries. We are updating our list, so I can't give you the extra slides now, but we will have them. And if we actually showed a map at the summit, colored in which countries are doing what. They promoted by DFID and DFAT in Australia for use in their development programs. And they were introduced as a means for collecting disability data in the 2030 recommendations for the census for the total world and for Europe. And coming out of the summit, the charter mentions using the questions for disaggregation. 300, you can say who they were, signed on to that. And many countries at the summit said they were going to adopt the question. So we're very happy to hear that. What do we have? On our website, there's lots of resources. You have the tools themselves, all of them, the implementation documents, the testing documentation, the translation. We have frequently asked questions, and we have blogs. A little bit more folksy about how the questions were used, particularly outside of an NSO, and that's the website. If you have any questions, that is the Secretariat's email address. We do try to answer all the emails within 48 hours, at least to tell you we have it and we're looking into it. There's a whole lot of information on the website about the implementation. Okay.
Thank you very much, Jennifer. That was a really interesting presentation, and that's a sort of a different sort of set of questions on disability. So maybe just very quickly, before we move on, would anyone like to ask a question of Jennifer about the Washington Group, which has been doing work for quite a long time now?
I wondered, when you introduce the questions into a survey, do you ever keep existing run them in parallel, or do they sort of tend to replace them?
I think every country is different because, again, we provide the tool, the countries incorporate them. In the US, when we first introduced them in 2009, we kept everything we had before, to the great chagrin of the people who were running that survey, and we did some split samples, and that's a relatively large survey, 35,000 households. And we have been comparing the way we used to ask them to how we're asking them now, and because some of those questions are also much more detailed, we tried to get an understanding of, so people who said, I have a lot of difficulty to that question, how did they answer the 10 hearing questions that we asked, and how did that work? And that was very, very instructive, but we have just redesigned that survey and we took everything else off. We did so much cognitive testing of these, we learned a lot about how not to ask questions, and many of the questions we had been asking for 20 years would never have passed the test if we had put them on, but we learned a lot about the relationship between the two. I think most countries, especially if they're not as data rich as a country like the US, they just tend to substitute them. But often they haven't been asking them for a long time, and between the censuses it's not worth it. So, but there are enough. And then, for example, Australia did some benchmarking, they did some split samples. So countries do it, but I think it's more to inform. The changing from a yes, no to 4 categories makes a difference. Getting rid of some of the stuff, mucky stuff that people aren't listening to makes a difference. Being a little bit more targeted, I think, was the main and specific.